Hello and welcome to the very best of living with Doctor. Promise where your health, happiness, and wholeness come first. Here, we share simple, practical, and powerful health tips, nutrition advice, wellness secrets, and evidence-based insights to help you and your family live your very best life. Because when you're healthy in body, mind, and spirit, you can thrive in every area of life. So hit that subscribe button and let's walk this health journey together, one step at a time. The very best of living health 001, your starting point for a better, stronger, happier you. Dear friends, today let's talk about something that affects millions of people worldwide: peptic ulcer. If you've ever felt a burning sensation in your stomach, especially on an empty stomach, you might want to pay close attention. What is a peptic ulcer? A peptic ulcer is a sore that develops on the inner lining of the stomach or the upper part of the small intestine duodenum. These ulcers occur when stomach acid damages the protective lining, leading to open wounds. There are two main types. 1. Gastric ulcers found in the stomach lining. 2. Duodenal ulcers found in the upper part of the small intestine. Causes of peptic ulcers. Peptic ulcers don't just appear out of nowhere. Several factors contribute to their formation, including septum 1. H. pylori infection. Helicobacter pylori infection is a common cause of ulcers in the stomach and the upper part of the small intestine. H. pylori is a type of bacteria that can weaken the protective lining of the stomach, allowing stomach acid to create an open sore or ulcer. H. pylori infection is usually acquired during childhood, and it is believed to be transmitted through contaminated food, water, or close contact with an infected person. Other risk factors for developing an ulcer due to H. pylori infection include being from a developing country with higher rates of H. pylori infection, living in crowded or unsanitary conditions, having a family history of H. pylori infection or ulcers, smoking or heavy alcohol use, chronic use of nonsteroidal anti-inflammatory drugs and NSAIDs like aspirin or ibuprofen if left untreated, and H. pylori infection can lead to chronic inflammation and ulcers in the stomach or small intestine. These ulcers can cause symptoms such as abdominal pain, bloating, nausea, vomiting, and weight loss. Treatment for H. pylori infection typically involves a combination of antibiotics and acid, suppressing medications to eradicate the bacteria and promote healing of the ulcer. It is important to seek medical attention if you suspect you have an ulcer caused by H. pylori infection, as untreated ulcers can lead to serious complications such as bleeding or perforation of the stomach linings. 2. Excess stomach acid. Overproduction of acid due to stress, spicy foods, or certain medical conditions. Excess stomach acid occurs when the stomach produces more acid than needed for digestion. This can lead to discomfort, acid reflux, or ulcers. Common causes include stress. Stress is a silent enemy that affects both our mind and body. While occasional stress is normal, chronic stress can lead to serious health problems, including stomach ulcers. Understanding how stress harms us can help us take steps to avoid it and protect our well-being. How stress affects the body. 1. Increases stomach acid. Stress triggers the release of hormones like cortisol, which stimulate acid production in the stomach. Over time, excess acid can erode the stomach lining, leading to ulcers, like of the 2. Weakens the immune system. When stressed, the body's defense system weakens, making it easier for infections like H. pylori, a common cause of ulcers, to thrive. 3. Slows digestion. Stress interferes with proper digestion, leading to bloating, acid reflux, and discomfort. A sluggish digestive system increases the risk of ulcers. B. Spicy or fatty foods can irritate the stomach lining and trigger acid overproduction. C. Medical conditions such as gastroesophageal reflux disease, Gerd-Zollinger-Ellison syndrome, or H. pylori infection can cause excessive acid levels. That were predictors, and this deciculus nepals are 3. Long-term use of painkillers. Non-steroidal anti-inflammatory drugs and NSAIDs like ibuprofen and aspirin can erode the stomach lining. How long-term use of painkillers can harm the stomach. Non-steroidal anti-inflammatory drugs and NSAIDs like ibuprofen, aspirin, and naproxen are commonly used to relieve pain, inflammation, and fever. However, prolonged use of these medications can damage the stomach lining, increasing the risk of ulcers and gastrointestinal bleeding. How NSAIDs affect the stomach. 1. Blocking protective prostaglandins. The stomach produces prostaglandins, which protect the stomach lining by promoting mucus and bicarbonate production. NSAIDs block these prostaglandins, reducing the stomach's natural defense against acid. 2. Eroding the stomach lining. Without enough protective mucus, stomach acid can damage the lining, leading to irritation, inflammation, gastritis, and ulcers. 3. Increasing the risk of bleeding. Meses reduce the ability of blood to clot, increasing the risk of stomach bleeding and perforated ulcers, serious ulcers that create holes in the stomach wall. Signs of stomach damage from NSAIDs: persistent stomach pain or burning sensation, nausea or vomiting, sometimes with blood. Dark, tarry stool is a sign of internal bleeding, loss of appetite, or bloating. How to reduce the risk: 1. Use NSAIDs sparingly. Avoid long-term use unless prescribed by a doctor. 2. Take NSAIDs with food. Helps protect the stomach lining from direct irritation. 3. Use alternative pain relief. Consider acetaminophen, paracetamol, or natural remedies if NSAIDs aren't necessary. 4. Drink plenty of water. Helps flush out excess medication from the system. 5. Ask about protective medications. Doctors may prescribe proton pump inhibitors, PPs, or H2 blockers to reduce stomach acid. If NSAIDs are needed long-term, safer pain relief options to protect your stomach. If you need pain relief but want to avoid stomach damage from NSAIDs, consider these safer alternatives. 1. Medications that are gentler on the stomach. Acetaminophen, paracetamol, a good alternative for mild to moderate pain. 2. Natural remedies for pain relief. Turmeric contains curcumin, a natural anti-inflammatory compound, available as a spice or supplement. Ginger helps reduce inflammation and pain, especially for arthritis or muscle pain. Magnesium helps with muscle relaxation and can relieve headaches and cramps. Omega-3 fatty acids found in fish oil and flax seeds. These help reduce joint pain and inflammation. 3. Lifestyle adjustments for pain management. Regular exercise strengthens muscles, improves flexibility, and reduces chronic pain. Heat and cold therapy. Applying a warm compress relaxes muscles, while an ice pack reduces swelling. Massage and stretching helps relieve tension and improve circulation. Hydration and proper diet. Eating anti-inflammatory foods like berries, nuts, and green vegetables can naturally reduce pain. 4. Consult your doctor. If you require long-term pain management, talk to your doctor about safe alternatives or protective medications like proton pump inhibitors, PPs, to reduce stomach acid. Symptoms of peptic ulcers. Ulcers come with warning signs. Here are some common symptoms: burning stomach pain, often between meals or at night. Bloating and burping due to excess gas production. Excessive burping or feeling uncomfortably full even after eating small amounts could be a sign of an ulcer. The inflammation caused by ulcers can disrupt digestion, leading to bloating, excessive gas, and discomfort. Loss of appetite, because eating may worsen pain. Dark or tarry stools, a sign of internal bleeding. Seek medical help immediately. Shocking signs you never watched for. Now let us uncover shocking signs you never watched for in ulcer patients' symptoms that could be the difference between early treatment and severe complications. Keep watching, because what you learn today might just save a life. Unexplained hunger pangs that feel better after eating. Many people mistake ulcer pain for hunger. If you frequently feel a gnawing sensation in your stomach that improves after eating, it could be a sign of an ulcer. This happens because food temporarily coats the ulcer, providing relief from stomach acid irritation. 2. Persistent nausea and vomiting. Feeling nauseous, especially in the morning or after meals, is another overlooked symptom of ulcers. In severe cases, ulcers can cause vomiting, sometimes with traces of blood, which is a serious red flag that requires immediate medical attention. 3. Unusual weight loss without trying. If you're losing weight unexpectedly, it may be due to an ulcer. Ulcers can cause a loss of appetite due to nausea, discomfort, or fear of pain after eating. If you notice unexplained weight loss, it's important to check for an underlying issue like an ulcer. 5. Dark or tarry stools. Blood from an ulcer can pass through the digestive tract and appear in your stool, causing it to look black or tarry. This is a serious warning sign of internal bleeding and should not be ignored. If you notice dark stools, seek medical attention immediately. 6. Chest pain that mimics heartburn. Ulcer pain can sometimes feel like heartburn or even mimic symptoms of a heart attack. If you experience burning sensations in your chest, especially after eating, but antacids don't help, it could be a sign of an ulcer. 7. Fatigue and weakness. Chronic ulcers can lead to slow internal bleeding, which may cause anemia. If you're feeling unusually tired, weak, or experiencing shortness of breath, your body may not be getting enough oxygen due to low red blood cell levels. 8. Bad breath halitosis. Surprisingly, ulcers can cause persistent bad breath. The imbalance of stomach acid and bacteria in the digestive system can lead to foul, smelling breath, even with good oral hygiene. 9. Pain that worsens at night. Ulcer pain often intensifies at night because there's no food in the stomach to neutralize acid. If you find yourself waking up with stomach pain or discomfort, an ulcer could be the culprit. 10. Intolerance to spicy or fatty foods. If you suddenly develop sensitivity to spicy, acidic, or fatty foods that you previously tolerated well, it could be a sign of an ulcer. These foods can further irritate an already inflamed stomach lining. 11. Unexplained breathlessness. If you feel short of breath even with mild activity, it could be due to anemia caused by a bleeding ulcer. Since red blood cells carry oxygen, a lower count means your body isn't getting enough oxygen, making you feel lightheaded, dizzy, or breathless. If you experience these symptoms along with other ulcer signs, seek medical help immediately. Many people suffer from ulcers without realizing it because they dismiss the symptoms as minor digestive issues. If you're experiencing any of these surprising signs, don't ignore them. Early detection and treatment can prevent serious complications like bleeding ulcers or perforation. If you suspect you have an ulcer, consult a doctor for proper diagnosis and treatment. Lifestyle changes, medications, and dietary adjustments can help manage ulcers and prevent them from worsening. How to prevent peptic ulcers. While ulcers can be painful, the good news is that they are preventable. Here's how. 1. Eat a balanced diet. High fiber foods like fruits, vegetables, and whole grains help maintain a healthy stomach lining. 2. Limit NSAIDs use if you need pain relief. Consult your doctor for alternatives. 3. Manage stress. Stress may not cause ulcers but can worsen symptoms. 4. Avoid smoking and alcohol. These irritate the stomach lining. 5. Consume probiotics. Yogurt, kefir, and fermented foods promote gut health. 6. Drink water regularly. Staying hydrated helps in digestion and reduces acid irritation. Best foods for healing and preventing ulcers. Ulcers can be painful and uncomfortable, but did you know that the right foods can help heal and even prevent them? In this guide, we will explore some of the best foods that promote ulcer healing and protect your stomach from future damage. 1. Fiber-rich foods. A high-fiber diet helps reduce acid levels in the stomach and promotes overall digestive health. Oatmeal forms a protective layer in the stomach, reducing irritation. Brown rice and whole grains help balance stomach acid and prevent ulcer formation. Fruits like apples, pears, and bananas contain pectin, a fiber that soothes the stomach lining. Vegetables such as carrots, broccoli, and sweet potatoes rich in vitamin A, which aids in tissue repair. 2. Probiotic-rich foods. Probiotics help restore the balance of gut bacteria and fight harmful bacteria like H. pylori, a leading cause of ulcers. Yogurt with live cultures helps replenish healthy bacteria. Kefir and fermented foods improve digestion and reduce inflammation. Sauerkraut and kimchi contain natural probiotics that strengthen gut health. 3. Healing fruits and vegetables. Certain fruits and vegetables have properties that promote stomach lining repair. Cabbage and cabbage juice, rich in glutamine, which supports stomach lining healing. Garlic has natural antibacterial properties that help fight H. pylori. Ginger reduces inflammation and protects the stomach. Honey, a natural antibacterial agent that aids ulcer healing. 4. Healthy fats. Good fats help reduce inflammation and support stomach lining protection. Olive oil contains antioxidants that aid healing. Avocados rich in healthy fats and vitamins beneficial for digestion. Nuts and seeds, almonds, flax seeds, chia seeds provide essential fatty acids that reduce stomach irritation. 5. Lean proteins. Protein is essential for tissue repair, but it should be gentle on the stomach. Skinless poultry and fish easily digestible and promote healing. Eggs a great source of protein without causing excess acidity. Legumes, lentils, chickpeas, beans provide plant-based protein and fiber. 6. Herbal teas and soothing drinks. Drinks can also play a significant role in ulcer healing. Chamomile tea soothes stomach inflammation. Licorice root tea DGL. Licorice helps form a protective coating on the stomach lining. Aloe vera juice reduces irritation and promotes healing. Prevention of peptic ulcer disease. Avoid long-term NSAID. Use non-steroidal anti-inflammatory drugs. NSAIDs like ibuprofen and aspirin can damage the stomach lining. Use them only when necessary and under medical supervision. Limit alcohol consumption. Excessive alcohol irritates and erodes the stomach lining, increasing ulcer risk. Moderation is key. Quit smoking. Smoking weakens the stomach lining and increases acid production, making ulcers more likely. Quitting smoking promotes healing and prevents recurrence. Manage stress. Chronic stress can contribute to ulcer development. Engage in relaxation techniques like prayer, deep breathing, and physical exercise. Eat a balanced diet. Avoid spicy, acidic, and highly processed foods that can irritate the stomach. Include fiber-rich foods, lean proteins, and probiotics for gut health. Maintain regular meal times. Skipping meals or eating irregularly can increase stomach acid production. Consistently eating balanced meals helps regulate digestion. Practice good hygiene. The bacterium Helicobacter pylori is a major cause of ulcers and spreads through contaminated food and water. Wash hands regularly and ensure food is well cooked. Drink plenty of water. Staying hydrated aids digestion and helps maintain the stomach's protective mucus barrier. Use medications wisely. If at risk for ulcers, consult a doctor about alternatives to NSAIDs or the use of protective drugs like proton pump inhibitors. PBs. Trust in God's healing and guidance. Do not be anxious about anything, but in every situation, by prayer and petition, with thanksgiving, present your request to God. Thank you for watching. Remember, your health is your first step to living your very best life. If you found this helpful, don't forget to like, comment, and share with someone you care about. And of course, subscribe and hit the notification bell so you never miss a chance to grow stronger, healthier, and happier with Health 001. This is from Dr. Promise, promising you the very best of life, one healthy choice at a time. See you in the next video. Stay healthy and God bless.